Hello. Have you ever heard someone say that either surgery or medication for weight loss is cheating? I know that I have. I'm here to tell you that I don't believe it is, and this is why. Welcome back to my channel. My name is Sherilyn, and I am on a journey to health and wellness through the clinical trial at the Cleveland Clinic. With this trial, I have been given Zepbound as a weight loss drug to compare its effectiveness to weight loss surgery. So if you're new here, I just want to welcome you and thank you for joining the crew, joining along. I'm glad you're here. So I asked the question, have you ever heard that weight loss surgery or medications to lose weight is considered cheating? And a lot of folks will say it is. But I beg to differ on that. And here's my reasoning behind that. If someone was to tell me that it is cheating to use medication or surgery, I'd first ask them to consider their own lifestyles and those of their families and ask them if their loved one has cancer, diabetes, heart disease, any of those things, and they're taking medication or surgery, would they consider that cheating? Because that's the real question. So oftentimes our bad habits lead to health complications, which require a hospital, a doctor, or medical interventions. This is very common. Most oftentimes folks don't go to the doctors if they're healthy. They aren't requiring surgery in most cases if they're healthy. And I'm not saying all, but most. So I wanted to bring to the attention of everyone who thinks that these things are cheating, a little bit of investigating that I did on my own, if you will. So I wanted to see what diagnosis, and I'm a healthcare professional, I'm a nurse, so I already know, but I looked it up anyway, just to be sure. What diseases or health conditions do Americans suffer from that require medication or surgical intervention? And I came up with a list of about 10 or so diagnoses. And you tell me if you know anyone who has these diagnoses and takes medications or has surgery to treat it. So the first one at the very top of the list for me is type 2 diabetes. I'm not talking about the type 1 diabetics here. I am only talking about type 2. And in most cases, not all of them, obviously, most cases of type 2 diabetes, they have this diagnosis because the way they have eaten and their lifestyle. If not their lifestyle of eating, it could be drinking, it could be sedentary lifestyle where they're not active and out running or walking or getting that exercise they need. But either way, their bad habits or their lifestyle have attributed to that. So that's just one. Another one is coronary artery disease. Now with coronary artery disease, that's where you're seeing the bypasses, you're seeing the stents put in. Those are from a buildup of plaque and the hardening of the arteries. So when you have coronary artery disease, that doesn't just happen. It can with age, but the younger folks that are getting these, it's because of what they've eaten or their lifestyles. Smoking oftentimes is attributed to that as well. We also have non-alcoholic fatty liver disease. So that's another thing that gets treated oftentimes with medication or a surgical intervention of some sort. It causes us to have non-alcoholic fatty liver disease. GERD. So many Americans suffer with gastric reflux. So GERD is the gastroesophageal reflux disease, and so many experience that. And most oftentimes it's because of our diet. When we're eating and those types of things, but our lifestyle is what's attributed to GERD. We take medications all the time. There's tons of over-the-counter medications you can get, Tums and Maalox and Mylanta, and the list goes on. And then you can also get Protonix and the other medications that are prescribed. We're taking these medications to help us with what our diet has caused. And oftentimes, and not all, but oftentimes in these diagnoses that I'm listing, when we get these diagnoses, we don't change our habits, right? We continue what we're doing and we take the medications to help us through them. If we're a diabetic and we want cake that day, we give ourselves extra insulin to cover our blood sugar levels. So it's no different here. So I'll continue. Gallstones. So gallstones are attributed to the way we eat. I'll never forget when I was in clinicals for nursing school, we were in surgery and somebody had to get their gallbladder removed. And I had a great doctor in there doing that surgery. And one of the things he said when he looked at us students was, there's all their cheeseburgers right there. And he pointed to the gallstones that were showing up on the radiological image. So that right there, I thought, oh, he has a good point. So gallbladder removal. People go in for surgery and get their gallbladder removed. Now, not all the time, but oftentimes because of the way they eat. Another thing is chronic kidney disease. We have a lot of folks who have kidney disease and end up on dialysis machines because of what they're eating and drinking or lack of. And we're ruining our kidneys, but we still provide those medical services to help them with that. Gout is another one. Gout is anyone who's experienced it, it's very painful, and it's most often in our feet, the joints of our toes and whatnot. That is from the foods that we eat. And so they have to try and stick to a good diet that will hopefully decrease those flare-ups. But it's still attributed to the diet. Hypertension, blood pressure. So a lot of folks who have blood pressure issues, it is related to their diet, smoking, bad habits, whatever it may be, lack of exercise. Obviously, some of these things are hereditary, but you get what I'm saying here. And a couple other things are, a stroke. A stroke obviously can be related to having hypertension from blood pressure, depending on what type of stroke it is, or a blood clot to the brain. Both, either way, could be attributed to the way we eat. And cancer. I'll end it with cancer. So there's various forms of cancers that we can get based off of our lifestyles and our diet and all of those things, our bad habits. And when they come to the hospital and we are treating them as medical professionals and they need, say, surgery, colon cancer, and they need to get their colon removed. If they come to us and they have lung cancer and we have to remove a portion of their lung, or if they gallbladder surgery, remove their gallbladder, stents, I went on all these things. Would we tell them that by doing these medical interventions, it's cheating? I don't think that we would. So I think we need to stop the stigma that's out there that medical intervention for weight loss is cheating, because it truly is not. I ask you to look inside yourself and see what you are doing and your health needs, and if you would find it to be cheating if you receive medical intervention to intervene on any of these diagnoses, plus more. So I thank you for sitting down and listening to my little TED Talk on this, but I get so tired of hearing it, and I feel for all of those people who battle obesity every day, who want change, who don't want to go out and have to have a heart attack or heart surgery, and they're struggling because we don't know each individual's own circumstances. We don't know what underlying diagnoses may attribute to their weight gain or what life experiences have attributed to their weight gain. So be easy on people. Don't be so quick to judge or quick to discredit what people are doing out there. Go out and show kindness and love and mercy just like you would any human being, regardless of what medical treatment they're receiving. So again, I want to thank you for joining me today. I ask that you subscribe and like so that you can follow along on this journey with me and everything I have to upload and keep you in the know on what's going on with my journey. So thanks again, and I will see you on the next video.